Yes, so you guys have 4 more minutes to log in, then we start the meeting. Good afternoon, Christine. I think 2 more minutes. Alrighty. So we are going to start this meeting. So good afternoon, everyone. I want to welcome you guys truly and thank you for creating time to come for this webinar organized by KMA in conjunction with KMPDO. I'm Dr. Dennis Miskela. I'm the Deputy SG for the Doctors Union KMPDO, and I'll be moderating this webinar. It was supposed to be presented by the SG according to the poster, Dr. Davji, but he's gotten an urgent family emergency that made him not be able to. But he's ably represented by a doctor who works in the office of the SG, Dr. Ojijo, who is going to present on his behalf on the above matter. So before we start, I want us to spare 30 seconds in honor of the healthcare workers who succumbed to this virus. So we start now. Okay, so with that, I pray for their souls to find rest, and I pray that their families get comforted during this painful loss. So to set the tone for this webinar, I want to read for you guys a post by President Biden, the president of USA, early this month when he passed some bill about how COVID had affected the healthcare workers. And it goes, this is, and there's a photo attached to this post. This is Dr. Lorna Breen. She was the emergency room director at New York Presbyterian Hospital when the COVID-19 pandemic hit in 2020. Dr. Breen was on the front line treating COVID patients. She came down with the virus herself, and after taking minimal time to recover, she returned to work. She appeared withdrawn, and her family encouraged her to come home, take a break, and seek mental health treatment. Tragically, she later died by suicide. Dr. Breen's story is just one example of the impact this pandemic has had on our healthcare workers on the front lines. Today, I signed a bill in her name, the Dr. Lorna Breen Healthcare Provider Protection Act. The bill will establish grants and require other activities to improve behavioral health among healthcare providers, and to aim to reduce and prevent suicide, burnout, and mental health and substance use conditions amongst healthcare professionals. Yeah, so that was the president of the USA acknowledging some of the effect that this virus has had on us. And as a union, we've been here from when the virus first came to this country, around I think 19th of March. And being that we're a union of healthcare workers, we have been at the center of bearing the brunt of what our workers have gone through. So today I want to invite Dr. Ojijo to give us a brief PowerPoint presentation. Then after that, we'll take in questions from the panelists, and even comments from the panelists and questions from the members of the audience. If anybody will have any comment to make thereafter, you just lift your hand or type your comment and we'll read them out. Karibuni sana, and Dr. Ojijo, take it away, brother.
Thank you so much, my SG now, who is also my boss. Welcome to this webinar presentation, guys, and all our partners, colleagues, and everyone else who is in this webinar. My name is Dr. Jijo. I work in the office of the SG, and I'm a general practitioner. Today, I'll be taking you through effects of COVID-19 pandemic on human resources for health. We all know probably that if there's anything that COVID has shown us, especially in our health system, is probably exposing the weakness that we have in our healthcare system. And more importantly, what COVID has also shown us is how important healthcare workers, or how integral healthcare workers are in any strong healthcare system. So that slide, probably if many of you will recall, it probably reminds you of 9th of December, the year 2020, of a young doctor, 28-year-old doctor by the name of Gusu, may his soul rest in peace, who passed on due to COVID-19. And this photo probably reminds us as healthcare workers that if anything has to happen in healthcare system, then we must be the ones to change anything that is bad that we need to change. So taking us through our slides, I must promise that I will not take long, so we will not tire any of us. I'll take you less than 20 or 30 minutes, and then we'll have input from all of us, those who want to participate, those who want to give comments, and those who want to ask questions. So as healthcare workers, like I've said, healthcare workers form an integral part in any resilient health system. And COVID showed us that healthcare workers are fundamental in any system that is strong, especially when with regards to COVID-19, we saw how healthcare workers were dubbed the frontline healthcare worker, frontline, we call soldiers. So there's a research which was done by the Human Rights Watch in the year 2021. And this research, those who were interviewed included union officials, we had leaders of associations, we had healthcare workers, and also the government. And what came out is that the report showed that the Kenyan government had failed to fulfill its pledge to support healthcare workers, exposing them to risks such as trauma, infections, and all other problems that healthcare workers went through. And we saw that the government actually failed to provide healthcare workers with the appropriate protective equipment, equipment to test, and also other safety measures to carry out their duty. And if I talk about protective equipment, all of us probably will know that this ranges from masks, boots, the gowns, the face shields, and even the respiratory N95. So that's made healthcare workers to protest, especially when it became apparent that the government was not taking the issue of COVID-19 pandemic, especially with regards to protection of healthcare workers. And that picture is just a representation to remind us of what we had to do to make the government probably act. You see a young man carrying a placard of hatutaki BBI, tunataka PPEs. And that probably reminds you of the days when COVID has just hit us and healthcare workers were dying, others were getting infected. So probably it's a quicker way of summarizing what we're going to talk through our webinar presentation. So among other things that healthcare workers went through, we noticed that infections was one of the most common problems that healthcare workers had to undergo. And there are statistics that proved this. We have global statistics that have proven this, regional statistics, and even in our country. There's a study which was done in Oman by the International Journal of Infectious Disease in the year 2021, which showed that healthcare workers had a positivity rate as at November of 2020 of 21.2%. And out of all those, we noticed that 61% of those infections were community acquired. And of also significant is the fact that 25.5% were actually hospital acquired. That means that most of the infections that the healthcare workers got, they got from their place of work. There's another study which was done in Europe as at May 2020, which showed that by that time, when COVID has just been discovered in Europe and had taken a few months, we had an infection rate of healthcare workers of around 152,800. And out of that, we found that most nurses were the ones who were affected at around 39%. In Kenya, as at July 2020, when COVID had just hit us and there was an uproar by healthcare workers, it was reported in July that 429 healthcare workers were actually were infected. And this accounted to around 4.1% of all cases, according to Kamala et al. By that time. So most of the infections were attributed to preventable causes, actually. We had people were complaining of inadequate PPEs. You will recall, because I was also on the ground, that we had cases where many of us did not have medical insurance. Even when you got infections, then you could not be able to go to the hospital and be treated for the same service that you are providing. So according to the National Association of Nurses 2020, there was a saddening statement that was made that you'll get sometimes nurses being taken from general wards and being sent to ICUs to take care of COVID patients without even being trained. And you all know that during that time, COVID had just come in. It was still new to most of us, and many of us did not know how to handle the situation as it was. So the other thing that came in was the issue of substandard PPEs that do not meet the occupational safety and health guidelines of PPEs. And this was highlighted by our union, Kenya Medical Practitioners and Dentists Union, our SG by then, because we had noted that there are cases where you go to hospitals and the healthcare workers complain of substandard PPEs that were being provided by the government or the hospital administration. And we also had cases of clinicians and other healthcare workers who are involved in transport of patients with COVID. And mostly it involved the ambulances and the other modalities that were used to transport COVID patients. And we found that those healthcare workers who are performing the duties of cleaning and disinfecting even those cars and vehicles were posed to chemical hazards like disinfectants from the human body fluids. And that was a very saddening thing that we noted. That other slide probably tells you something that I may not need to say. We see a gentleman and a lady sleeping in an hostel setup. And if you can brainstorm properly, you will notice that this could be a case of burnout. And that takes me to the next problem that we as healthcare workers had to go through. And that's the issue of burnout. It is said that in Kenya currently, this statistic could have improved by now. This was 1 year ago. Kenya has approximately 58,000 registered nurses. It has around 12,000 registered doctors. This is high now, and around 14,000 clinicians. And what that tells you again is that if you compare the total population of Kenyans in the country vis-a-vis that of healthcare workers, you find that the WHO recommended ratio for doctor to patient ratio should be 1 to 1,000. But in Kenya currently, we are having a doctor to patient ratio of 1 to 16,000. That's according to the Kenya Medical Practitioners and Dentists Union. And the Nurses Union actually have stipulated that the nurses to patient ratio currently is 1 to 30 patients. That means 1 nurse to 30 patients. The WHO recommended ratio should be 1 to 6 patients. So you can clearly see that there is a big mismatch. We are having a country where we are having doctors who are trained, nurses who are trained, clinical officers who are well trained, but they are not absorbed by the government. And the country still has a problem of shortage of human resource. So it's a very sad statement. And we have noticed, according to the research which I've said, which was done by the Human Rights Watch, it reported that the government of Kenya did not deliver on its promise to hire an extra 11,000 healthcare workers. Many of you will recall that on May 2020, there was a directive by the government that they set around 1 billion shillings to hire more healthcare workers. But the truth on the ground is that we did not meet the 11,000 more healthcare workers that were supposed to be hired. And what the government did is that they went ahead and contracted less than 300 doctors on contract, and then put them under UHC program. They went and hired less than 1,000 nurses, and then distributed the 1,000 nurses across the country. That means each county got approximately 10 nurses. That's according to the Nursing Association of Kenya. So we clearly see that there was a problem of many patients who are coming with COVID infections, but those who are in the hospitals to take care of them were very few. And therefore we had many doctors, many healthcare workers in general complaining about the burnout in the hospitals. The other thing that we talked about, which is a very, very saddening situation, is that if you look at that picture, it probably reminds you of the person I talked about. On the left side is the dad. That means that there are healthcare workers who are to pay the ultimate price, especially during COVID-19 pandemic.
We cannot see the screen. Excuse me. We cannot see the screen.
Okay. Sorry for that. Let me just. Can you see it?
You can go. Yeah, that's yeah.
So like I was saying, the picture you see probably reminds you of the sorry state of affair that we had to go through on 9th of December. And I talk about this because this was a young doctor like myself. I knew him personally, and I knew the kind of troubles that he had to go through just to take care of the Kenyan citizens that he loved most. He went and paid the ultimate price because of COVID. So there are statistics that have shown that in Europe, we had, as at August 2020, that we had 37.2 deaths per 100 infections of healthcare workers who are aged about 70 years by then. There's also another study which was done by the British Medical Journal for Global Health that stipulated that on the Eastern Mediterranean, we had 5.7 deaths per 100 infections. This was low as compared to the infection that we had in Africa by then. But if you recall, in July, mid-July 2020, that's the first time that we reported the first case of a healthcare worker who had succumbed due to COVID. And according to the Kenya Medical Practitioners, Pharmacists and Dentists Union, it was reported that at that time, in November, that is, we had lost around 18 doctors due to COVID-19. And among the 18, we had around 10 specialists who had lost their lives due to COVID. I remember vividly, we had a dental surgeon who used to work in Kenyatta National Hospital who succumbed due to COVID. I remember also vividly my lecturer from Moi University, who was a plastic surgeon who had to succumb again due to COVID. And many others, many general practitioners, clinical officers, nurses have succumbed due to COVID. And these are just a few cases which were reported then, which came to the limelight. But many of us will probably agree that we have lost so many healthcare workers due to COVID-19. I got to interact and talk to the Kenya Union of Clinical Officers Secretary General, who reported to me that there are so many clinical officers who have died due to COVID since the time the pandemic came into the country till this time. And many of those doctors and clinical officers, the statistics may not be very clear, but if you are a healthcare worker, probably know of a colleague who succumbed due to COVID, which is a very, very sorry state of affair. And we found out that most of these were attributed to lack of personal protective equipment. And we also had cases of doctors who are providing services, healthcare workers who are providing services in hospitals who could not pay for the same services that they offer. So you'd go into a hospital, look after patients, get infected, you get COVID-19 complications, but then when you're taken to the hospital, either you cannot pay for the ICU services, you cannot be admitted in a hospital because you don't have a medical cover. That's a very sorry state of affair. The next slide, you see a healthcare worker holding onto the forehead. And there's another hand behind, which is slightly darker than the hand that holds the forehead. So that tells you something that there's something going on with this healthcare worker. They're probably regretting about something. They're probably thinking so much about something. And that brings me to the issue of mental health among healthcare workers. And we find that one of the most common complications that we've noted, especially with regards to mental health, is that many healthcare workers had to undergo depression during the coronavirus pandemic. We had a study which was done in Europe again by the Western Journal that stipulated that around 5% of healthcare workers faced between moderate to severe depression, and around 8.7% of them had extremely severe depression. And most of these were actually work-related. So you'll find, like I've said, you go to a hospital, see your patients very well, take care of them. And then back at home, you've lost a colleague. Back at home, you've lost a relative. Or you are in a hospital setup, you don't have the personal protective equipment that you need to handle patients. And then you have to see patients die due to COVID. And then if you culminate all that with the burnout issues that we talked about, then you find that depression set in. The other issue that was there is the issue of anxiety. It was reported that many of healthcare workers, over 96% of them, were worried about the issue of transmitting COVID-19 to their loved ones. And this may resonate well with some of the healthcare workers, because as a father, maybe you leave your house, you go to work, and you know very well that you are highly exposed at work. And then you have to go back to your wife who has a small child at home. You see, you'll have to think so much whether you really need to do that. We had cases of people who would go to the hospital, they see patients, and then they have to relax and think about whether they have to go home. Because during that time, there was a problem, the COVID had just hit and it was spreading so fast. And many of the people were scared about that. So you'll find cases where your little ones, like your child, will be complaining and telling, Dad, do you have to go to the hospital? And then you'll say, talk about the oath that you took, that son, I have to go to the hospital. But you hope that God protects her, which was a very, very, very sorry state of affair during that time. So we had also cases of healthcare workers who had struggles thinking about suicidal ideations and issues of attempted suicide. And this was mainly due to stressful work conditions at work. So you'll find that you are forced to work in a hospital setting where there are no protective equipment, you have no medical cover, you've lost your colleagues, but you have to go to work either way. So that would leave some people thinking about taking their lives. That next slide, you see a statement that I offer services that I cannot afford. And what that means is we had cases where healthcare workers were hired by the government, and in particular those who went under UC program, and they were working in COVID center, my Q. They went for 6 months without pay. And that is the case that we had for the likes of Dr. Mugusu, the late. So you find a situation where as a young doctor, you are looking for a job, you have to go to work, you have been hired by the government, but you've worked for 6 months without pay. And then you get COVID-19 in the process. So you find yourself that you have no money, you are now sick, and you have to go to the hospital to take care of yourself. And this was a very sorry state of affair that the union had to come in, the associations had to come in to request the government to pay the healthcare workers that they had hired. So that probably will tell you that something next had to happen. And then now came the issue of industrial actions. We had, because the government can only sometimes understand demonstrations, industrial actions when people picket. We had in June 2020, the nurses in approximately 5 counties had started their strike, and then followed the clinical officers, and then the doctors before they called off the strike in December 2020. I recall very well the clinical officers had to call off the strike somewhere in February 2021. So that was a very sorry state of affair that healthcare workers who were supposed to be in the hospital taking care of patients had to undergo industrial actions for their pleas to be heard. And like I've highlighted the issue of delayed salaries, the government had promised about COVID-19 risk allowance, which I recall very well, came once and then died a natural death. So that was a very, very, very sorry state of affair. That is just a summary of the plight of healthcare workers, the effect that COVID-19 had to take toll on them, for them to actually provide services to the citizens that they love. Thank you so much. May God bless you.
Thank you very much, Dr. Jijo, for a well-elaborated presentation, and also thank you for keeping the time. Yeah, we know that recently we had the healthcare workers conference in Safari Park, and one of the issues we were discussing is how to build back a better, more resilient and stronger health system. Because as you have ably said that COVID did not break our healthcare system. COVID just exposed our weak healthcare system. COVID did not just break healthcare system in America with those millions dying. It just exposed the weaknesses in that system and many other countries. So it's up to us as the people in this sector, both as consumers, as service providers, as players and all that, to decide on how we can ensure that if we to have another pandemic, we don't have to lose as many healthcare workers, etc., etc. I was just reading some online article about that COVID made the healthcare workers become not so keen on the practice, that by around 2035, that so many, they will be having a shortage of healthcare workers all across, because people are going to be moving away from the trade, because you can't be a frontline soldier when you're not fully equipped. People are struggling with the PPEs, not just in Kenya, but even in the Americas. I saw on their media, people struggling with PPEs and all that. I can see a comment from Eddie that the pandemic has exposed healthcare in Kenya at a great level, exposed healthcare workers, inequipped facilities, inadequate human resources, poor flow, supply of drugs, blah, blah, yeah. Do you think under national government, this would have been different? Yeah. So Eddie is trying to ask if health was a centralized service, would have been different. And of course, with the we can only theorize that probably yes, could have been different, because the biggest challenge we had as a union when we were highlighting some of the issues around COVID is that the disjointed response. Yeah, that the counties, when it comes to building isolation wards, when it comes to buying concentrators, oxygen concentrators, they want to say how health is devolved, and they are not be given money, and they are given money, 300 million almost per county to put those equipment. But what did you see? You saw some of them hiring beds, ICU beds privately, like in Isiolo, where they apparently launched an ICU facility, yet a nurse died being transported from Isiolo to Nairobi. Yeah, so you wonder that were those ICU beds there? Number two, when they're in building up those ICUs and they don't have the requisite trained personnel in those places, like an anesthesiologists to man those ICUs. No, ICUs are not just beds and monitors. They're human beings, theater and ICU nurses and intensive care doctors and all that. Yeah, so I'm sure that if it was left to national government, it could have been much better, in my opinion. But then again, it's a case of hindsight. Nobody really knows what would have been. Probably would have been also be a delay with the fact that sometimes the COVID was disproportionately covered in the country. Like, for example, in the northern frontier counties, those are much as severe as in other countries. So nobody really knows, but what we can say that because of the spectacular failure of the counties, a better job could have been done probably in curbing the situation. Yeah, I can see Vivian is asking, did the government offer any kind of compensation to Dr. Mogusu's family? As a union, we pushed, and his dues were paid. Yeah, about the damages that the OSHA Act, Occupational Safety Act, we are not aware that it was given any WIBA compensation. And of course, about WIBA, in the conference that we had the other day in Safari Park, the Department of Social Protection in NSSF talks about that only 40 cases we mostly came from Garissa of claims were forwarded to them. So any healthcare worker outside there who got COVID and died or got disabled or debilitating complication, you are supposed to fill a form at the Department of the Occupational Safety Health in the Ministry of Labor, so that you can process your compensation because you got injured at work. And as a union, we pushed for government to consider the infections and complications coming from COVID as occupational hazards. So that's it. Any comment? Anybody with a comment? You can raise your hand. Yeah, I'm seeing someone say that would these conferences be free so that unemployed healthcare workers can attend? Yes. The conference that we had only had a registration fee of 3,000, but various unions also paid for their members to attend. So probably next time Gibbon Learning will also be inviting more and paying probably for even the unemployed workers. Belia is saying that thank you for the presentation. The doctor-patient ratio is shocking. What the role of the union in ensuring that the improvement of the ratio is done? Yeah. So Belia, the one thing that KMPDO has consistently pushed for is employment of doctors. Yeah. From when COVID came, we pushed for more employment, and the doctors are employed, and not just doctors, but even healthcare workers were hired under the UHC program. Right now, we're really struggling to have them have their contracts renewed and they be absorbed on PNP. If in fact, in the conference that we had, one of the things we agreed on was that if we are truly frontline soldiers, they we have been made to believe. Every year we see that the military recruits annually. We see the police recruits annually. How comes that healthcare workers is the only time that we don't recruit annually? Yet we are also soldiers who also fight enemies just like everybody else. So if the pandemic has not taught us the need for us to be self-sufficient, then I don't know what will teach us to do that. But as a union, we keep on pushing. We keep on pushing for that continuous employment. Moses Chun is asking, what's the fate of the healthcare workers who are on contract terms? Yeah, and also some healthcare workers don't receive the COVID allowance. Yeah, we remember when we did our strike during the pandemic, and it was a very, very tough choice for us because we were like, is it fair enough to go on strike during a pandemic? But things had reached where they reached, and we felt that our healthcare workers were being overworked and overwhelmed, and that's why the UHC doctors and workers were hired. Sadly, we have noticed that the contracts have expired, and we have been really pushing very, very hard to not only have their contracts renewed, but we also want them to be absorbed. They are people who put out their lives. Like Dr. Mogusu, for example. What you know that Mogusu was a UHC doctor and was covering a COVID center in Machakos. And when he fell sick, he couldn't afford to go to that center. He not had salary for 5 months. So these are people who have sacrificed, some with their lives, some with working, knowing that they will infect their loved ones. So we'll continue pushing so that the government can absorb and convert everybody to PNP who have worked under that UHC program. Because beyond just COVID, we still have other health issues that have been worsened by COVID. Rather, there's this cancer patients who are in stage 1, who are now probably in stage 3 or 4, who have to be cared for. There are these patients who had hypertension, who because of the lockdown missed their clinics and now have stroke and need to be cared for. So there's so many other needs that arose from that COVID that still require that we have the numbers to be there. Now, I'm hearing about healthcare workers who did not receive their COVID allowance. I hope and believe that those healthcare workers can always approach the matter through their respective unions. And if they're doctors, they can come to us and tell us about it. Then we can see how to push for it. Because one thing for sure is that we negotiated for every healthcare worker to be paid a certain amount of allowance for the COVID. Yeah. So they are being let me just see the comment from who is this? Helen, that I think it's high time the government considered the mortician and healthcare workers. When COVID-19 came, doctors, nurses were being trained all over on how to handle cases. Now the training morticians how to handle the bodies. The trainings came much later when the days are already there. Yes, I agree with you. I truly agree with you that there are so many people in the system that are not appreciated the way they should be. The morticians are supposed to be at the forefront, like in a pandemic where we know that death is inevitable. The training, the protections and all that. Remember that when the first deaths were being reported in the country, and you remember that gentleman from Syria and how he was handled. I know with some of those handling of the dead, it also worsens the stigma. And in Africa, somebody said in the conference that in Africa, for us, funerals and death is something very, very personal. And that event and the cultural and how we handle that gives us closure. We want to see the body. How do we ensure that people are able to probably have transparent body bags to see their dead ones? Because what it did then when we criminalized the public health concerns in the COVID is that people began hiding. When you have somebody dying, having corona, you hide it. When they die, you hide it and get exercise they have died. And it really made the spread even got worse. So I agree with you that moving forward, not just the morticians, we even have what we call the community health volunteers, which should be community health workers, because these are the people who are, if you are really truly going to move towards the UHC, as the government is trying to say, they cannot be UHC without us ramping up the preventive healthcare services. And the first line people to handle the preventive healthcare services should be community health workers, not only volunteers. So there are so many sector players that have yet to be appreciated and recognized for the roles that they play. So I agree with you fully on that. Uh-huh. I can see Chris Odoyo is saying the KEMSA scandal was an aftermath of the COVID-19 pandemic. Does it not directly impact on the healthcare workers on the ground? True, Chris. And KMPDU has been in the forefront asking and pushing hard so that the people who are involved in the scandal be prosecuted. Because what really broke our heart that as we were complaining about shortages of PPEs, as we were being made to wear one mask the whole day, as we were being, I think the hazmat, the gowns, the shortages, the gloves, as we were suffering every day, KMPDU to do weekly press conferences, pushing and asking for more. As we were being given PPEs with poor quality, somebody else was pocketing money. In KEMSA, we were told that their stock worth running in billions of shillings, who they don't know where to take. They were bought for COVID and they were not used, and now they're just lying. So yes, corruption has a price, and as citizens, not just healthcare workers, we all pay the ultimate price every time there's corruption, and that's why we must always call it out and ask for better governance in not just in the healthcare sector, but in the country. So I don't know if there's any other comment from any person. Yeah, so I'm not seeing anybody raising their hands. So in closing, I would say that as KMPDU, we really appreciate the partnership that KMA and Equity Foundation brought in on board when this COVID when I'm seeing before I finish, I can see Stella. Stella, you raised your hand. Stella Tinega. You can talk, Stella. You can unmute, then talk. Stella. Unmute yourself, then you talk. As Stella works on that, I'll just continue that. Yeah. So we really thank Equity Foundation for the partnership that they brought to us, and through that we are able to get PPEs. Like, can really appreciate the fact that when the local manufacturers were mandated to manufacture the PPEs, we were literally involved from the scratch. When the manufacturer designed the first, we were called to check on the qualities. What we did not like the weight, we didn't like about the permeability, they changed. So it really made us feel important and feel involved in the process. And as with KMA and the other health care association and unions. So that's it. We really appreciate all the healthcare workers who went beyond call of duty and sacrificed personal and with some of their lives to ensure that we are able to fight this. We know the fight is not yet over. We still have COVID in the country, and we hope that our healthcare workers will be at the forefront, not only in pushing for our members to get vaccinated and get the booster doses, but let us also push for our patients, because so long as we don't vaccinate our patients, they're going to fall sick and they'll put us at risk too. So let's still push for the vaccination to continue now that the general public health steps that they put to control movements and all that have been stopped. There are still going to be risk of infection. So let us all get vaccinated and help each other in kicking out the virus out of the country. Yeah, I'm just seeing a final comment here before we close. I'm saying, are the unions aware the share of healthcare workers we have in the counties? If yes, what are they doing? I think I answered this. We know that the shortages are there. As healthcare workers unions, we have talked about it in the conference we had last week, but where we were pushing for hiring of 12,000 healthcare workers within the UHC program and all that, and we're pushing for the annual recruitment and retention of healthcare workers. So we'll continue doing that, and we really like the new synergy that the health unions and associations have gotten, so that we are all speaking in the one voice rather than us speaking at cross purposes. We're now speaking in one voice, and we hope that probably with the new dispensation that will come, they are all talking healthcare, and we're happy to hear that Raila is talking about Baba Care, Ruto is talking about the UHC and the NHIF program. For the first time in an election, we are hearing people talking about healthcare. So let us all continue pushing hard. Let us talk to our patients, our politicians, and our patients, our voters, to ensure that healthcare can become the center stage. I hear people talk about the economy, but COVID taught us that without health, there's no economy. We shut down companies, we shut down businesses because of health. So health is at the center of it all. So we hope that each of us will be our own ambassadors of our sector to push for a more responsive government when it comes to our needs and the needs of our patients. So thank you very much. And with that, I want to declare this meeting and this webinar closed. Thank you so much and be blessed. Asanteni sana.